Hey, long time no see. How are you? Well, my memory's shot. I can't pay attention. I'm in a constant fog. Maybe I'm just not sleeping good enough. Do you think I should take a few more of these? What are those? Sleeping medications? Yeah, I got them without a prescription there at the pharmacy. Now you know we're not supposed to be taking those anymore. Oh, why was that? Well, let me explain. Can you believe it? That really was me just a few years ago, when without even realizing it, I was taking medications that were affecting my concentration, my learning, and my memory. Now, in my particular case, this happened because I hurt my back and ended up having 3 back surgeries. And during that time, for years, I took narcotic medications and I also took muscle relaxants. Now, these two are great examples of a type of medication called anticholinergics. Anti means to block, and cholinergics is as it pertains to the neurochemical acetylcholine. So acetylcholine is a neurotransmitter. Neuro for brain, nerves, and transmitter because it is the chemical that transmits the messages through the nervous system. So acetylcholine is everywhere. It is in our eyes, it is in our mouth, it is in the gut, it is in our bladder, it is the neurochemical responsible for muscle contraction, and in the brain, it is one of the most important neurotransmitters responsible for clear thinking, for learning, and for memory. So when we take a medicine that blocks the action of acetylcholine, like for example, I was having back pain and having spasms, so I would take a muscle relaxant for that. It would block the action of acetylcholine in my back, relieving my spasms, but it would also block the action of acetylcholine in my brain, where it would make me feel a little bit sluggish mentally, where it was a little bit more difficult for me to concentrate, and where it was affecting my memory. Now, you would imagine that with the potential to really affect cognition in this way, that anticholinergic drugs would be only available by prescription, but that is really not the case. Anticholinergic drugs are in over-the-counter sleeping medicines, over-the-counter medications for acid indigestion, and they are in many antihistamines, medications for cold and flu. In my daily work as a psychiatrist, I see many people with memory loss and dementia. And many of them are taking a class of medicine called cholinesterase inhibitors. Basically, the way that these medicines work is that they increase the levels of acetylcholine in the brain. And by doing so, then they improve memory, they improve learning, they improve concentration, etc. So when we take an anticholinergic, we are interfering with one of the most important neurochemicals that is responsible for clear thinking, for good concentration, and for deposition of new memories. After one of my talks on this topic, one of my colleagues from the community came up and she said, "Gosh, doc, would it be possible that this muscle relaxant that I am taking is responsible for my brain to, quote unquote, work with a 3-second delay?" So she went on to tell me that she had gotten in a motor vehicle accident and hurt her neck. And as a result, they started her on a muscle relaxant called cyclobenzaprine. She had been on it for a couple of months and had noticed a huge slowing down of her cognition and her capacity to reason and to think. So what I told her was, go talk to your primary care doctor, let him know that you want to be tapered off of this medicine, and maybe use some magnesium. That is something natural that can help with muscle spasms. So I got a text from her about 5 days later saying, "Wow, the fog has lifted." She said, "I had no idea that this little tiny pill was really responsible for such memory loss and such concern from my part that something was really wrong with me." Actually, there is a study from France that was published in the British Medical Journal in which they looked at chronic anticholinergic use. And what they found was that folks that were taking this medicine on a daily basis met criteria for mild cognitive impairment. So think about that for a second. What this means is that this little tiny pill, whether it's a muscle relaxant or a medicine for urinary incontinence, can affect your mind in such a way that you too can meet criteria for a psychiatric diagnosis. It is really serious stuff. Now, what are some of the milder side effects of anticholinergic drugs? Now, remember these two that are really important. Number one, dry mouth, and number two, constipation. Whatever they prescribe to you, look it up online and see what are the typical side effects. If you see dry mouth and constipation, that little light should go up in your head saying, wait a minute, this may be an anticholinergic drug. Anticholinergics are also notorious for causing vision problems, things like double vision and problems with focusing of the eye. Anticholinergics can cause problems with balance and coordination. So imagine, if you're an elderly person and you're taking a medicine that gives you blurry vision and makes you unsteady on your feet, it's kind of a recipe for trouble. And it's known, anticholinergic drugs make falls more frequent. And the people who take anticholinergic drugs on a frequent basis have a higher rate of broken hips and fractures. Now, some of the more serious side effects of anticholinergics, in particular if you're elderly, are acute mental status changes, what we call delirium. And this includes things like visual hallucinations, agitation, confusion, kind of waxing and waning of consciousness, delusional thinking, falls, accidents. And actually, this is one of the main reasons why I get called in. When I receive a consult for a patient who is elderly and who is having acute mental status changes, the number one thing I look for immediately is at the medication list and to see if I can identify that they're taking anticholinergic drugs. Now, my motto is every form of healing has its place. Pay attention here because this is important. An anticholinergic drug may be the medicine that saves your life. If you've had back surgery and you need to take a muscle relaxant that's an anticholinergic, take it. If you're breaking out in hives and you need to take an antihistamine that has anticholinergic properties, take it. The issue is not so much taking these medicines short term, but being exposed to taking these medications long term, year after year. It is also important to realize that the effect of these medicines is cumulative. So if you're taking 2 or 3 anticholinergic drugs, the effect adds up. The higher the anticholinergic load, the higher the risk for developing side effects. And this is particularly important as we get older. The chance and likelihood of developing side effects really skyrockets. So what to do if you recognize that you've been taking an anticholinergic drug on a regular basis? Well, know that there are safer alternatives. For example, if you've been taking a sleeping medication that is an anticholinergic, just know that melatonin, valerian, hops can be used safely for this purpose. If you're taking a prescription anticholinergic such as a muscle relaxant, number 1, discuss it with your doctor. And number 2, know that things like magnesium and Epsom salt baths can be beneficial. I will discuss safer alternatives in future videos. Thank you for listening. Hit that like button, subscribe, and I will see you next time.